What's up? It's your favorite NPHP and welcome back to my channel. As you can see, I am outside in my backyard. I just came back from the gym. I put little mama to sleep. I think it's about like 12:30, 1 o'clock in the afternoon. And I thought, hey, turn on the camera, H. You know, you don't always have to turn on the camera when you're at work. You know, try to get some footage and some content out there while I'm here at home. So today's video, I thought I'd just talk about my experience so far from being a nurse to becoming a nurse practitioner, and basically what are the biggest changes that I've noticed that I've been through. So just a little background. I was a registered nurse in a hospital for 4 years on night shift. Now I am a nurse practitioner in a hospital on night shift. So first thing first, it's like your mind frame changes completely. When you're a nurse, you go to work and you're basically told what to do. There's a time to give a medication, 8, 9, 10 o'clock, midnight, 6 a.m. So you're told what to do. You know, you have your plan already set out, and you just listen to the orders, right? You have orders, you follow orders. If you have questions, you call your provider. Now as a provider, as a nurse practitioner, like I said, it changes. Now we are that provider. You know, we are the one on the other end of that phone call, you know, receiving the calls when the nurses have questions. We are the one putting in the order. So that's like one of the biggest change, one of the biggest like eye openers. Sometimes I still walk down the hallways like, can't believe where I am in my career. And just by simply answering the questions and, you know, explaining to the nurses whatever question they have and trying to get them to think of why we're, you know, ordering whatever labs, whatever imaging, and just like explaining to them and, you know, seeing their reaction and seeing how they, you know, could grasp on exactly what we do as providers. It's like, it's just crazy how now, I hope you guys can hear me, it's windy. So it's just crazy how like it's completely changed. Like I said, it's like we're not following orders, replacing orders, and that's one of the biggest changes, you know, as becoming a nurse practitioner. And as I mentioned in one of my first videos, it was extremely hard being confident and comfortable putting in orders, you know what I mean? And basically everything is based on education. For example, just treating high blood pressure. What's your go-to medication? What's your first line? What's your second line? If your first line doesn't work, what's your second line? And what if both of them don't work? So it's based on education, you know, research, and which we obtain through schooling, which we obtain through experience. But yeah, that's one of the biggest, I say, changes that I have experienced, and I feel great. I feel confident. I'm going on 2 years now as a nurse practitioner. So in the beginning, like I said, I was nervous, but now I feel confident. Like I said, through experience and just through education and everyday learning from the doctors that I work with, I became more comfortable in that. So that's one thing. Another thing that I've noticed, again, you know, referring to the hospital, I had to learn to step away from bedside. The unit that I work on, that's the unit that I cover. So my office, my call room is on the unit. So when I hear the call light go off, if I'm walking down the hallway, if I hear the call light go off, if I hear the bed alarm go off, it's like my instinct is to be there, is to run, because that's how I was, you know, trained as a nurse, like as bedside nurses. And when you become a provider, you have to literally like turn that off, because there's a lot more bigger, important things that we have to take care of. If it's admitting a patient, it's a bedside evaluation due to acute changes, if it's emergencies, ERTs, like we have to remember, we have to attend to those first before trying to help somebody, you know, to the bedside commode or making sure they don't fall. Granted, I always peek in to make sure no one's gonna fall or whatnot, and I tell them, you know, stay in your bed, the nurses come in, and I quickly, you know, grab a nurse. But so that's another thing that I've learned to back away from bedside nursing. And honestly, at the same time, you want the nurses to learn, like, especially if nurses having trouble like placing NGs or placing Foleys, I would help. And I remember one time a doctor mentioned to me, like, why isn't the nurses doing that? And I'm just like, I'm just helping out, trying to help out and such. So that's another thing, is just you have to like try to step away from the bedside. And that was, I mean, it wasn't like hard, it wasn't a struggle, but it was just kind of awkward. It's like you hear a bed alarm, you're taught to sprint and run to make sure everyone's okay. And now it's like you hear a bed alarm, it's like you have to actually sometimes pretend you don't even hear it and make sure there's somebody, a nurse, somebody going. So that's another change that I experienced. And just as a provider now, it's like you're doing a lot more thinking, a lot more critical thinking, a lot more looking up things. And because we're now diagnosing, we're prescribing, especially in the hospital, when I'm admitting a patient not knowing what's causing their abdominal pain, I need to make sure my exam techniques are on point, just make sure I'm ruling things in and ruling things out, and then being able to order the correct imaging, the correct lab tests and things like that. So it's like, it's totally different. We are now practicing similar as doctors now, and we all know what they do. We all know. Please don't spin me. Why are you bothering me? Please don't spin me. I'm probably gonna get stung. I don't want to. So yeah, so those are like just the biggest changes that I have experienced. Just like a quick update, where I'm at in career-wise. I'm 2 years in working as a nurse practitioner. How I'm feeling? I'm feeling great. I'm feeling a lot more confident. Like I said, this bee is not going to leave me alone. I'm feeling a lot more confidence. The doctors are seeing my growth. There's one particular doctor that I work with. He's a nocturnist. And he continues to tell me how amazed he is of how I've grown from when I first started to where I'm at now. Granted, this is 2 years in, so no, it's going to come to you through the repetition, through the consistency of seeing certain diagnosis and treating certain things. Everything's going to come, and it's going to become a lot easier. It is. Like, I can't believe where I'm at now. Like, I go to work. I used to go to work my first year nervous as to what doctor I'm working with, how am I going to present to them, what patient I'm going to admit to the hospital. Hopefully they're not a hard case. Now it's like, bring it on. It's like, I know what to do. If not, I know where to look it up at. And if I still don't know, I have wonderful doctors. I at least present to them what I think, what I feel, my suggestions. And as long as I present that to them, they always help. They always see where I'm coming from. They understand why I may be confused. Because I tell them, oh my gosh, this bee is not leaving me. I tell them. So they're so nice in there. No, oh my gosh, I might have to go to another location since I am in this bee's territory. Hopefully there's not, oh my gosh, a beehive beside me. Look, oh my gosh, it's landing on the camera. And I'm touching it, I'm swinging at it, and I don't want to swing at it. We're leaving. We are going to change this location. I had my son's little chair relaxing back there. Hi, Grandpa. How are you? I got attacked by a bee. The bees are attacking me. But I'm on the front porch now, which the bee can still come and attack me, but whatever. So, where did I leave off after being interrupted by this little creature? Yeah, it's about basically where I'm at. So, one of our NPs actually left, and there's a new NP starting in January, and I was asked just to basically precept her. It's not really precepting because she's been an NP for a couple of years, and she actually was coming from another hospitalist group. So basically, I'm just gonna show her the ropes at our facility. So nothing much, but I feel, I feel good about that, and I feel happy that they had asked me to do that. So that'll be happening in, January when she starts. So right now we're only 2 NPs, and the doctors are struggling a little bit when there's no NP on. I cover about 55 patients. So when we are not on, the attendings have an additional 55 patients. And the bees here. And the bees here. So that bee done ran me in the house because we are not having that. Okay. No, we are not getting stung. So anyway, where was I? Yeah, so when an MP is not on, the doctors, yeah, have a lot more patients to cover. So, but yeah, things are great. Like, I'm loving it. Like, one thing I always knew and wanted from a job, from a career, is basically waking up and not regretting having to be at work. And in the beginning, the first year, I was just like, I did feel a little regretful, like, oh, here we go, and nervous. But now I'm a lot comfortable. I'm excited to see what attending I'm working with. We have a bunch of new attendings starting. These are attendings that just literally just got out of residency, so they're open to teaching, and like I'm continuing to learn so much. And I love the job. I love the job. And I'm not thinking of leaving anytime soon. I'm thinking of doing something else, but it has nothing to do, well, it's similar to healthcare, but it's not like, we'll talk about that when I eventually, you know, decide. But yeah, so I'm still working 3 nights a week. I try to do 3 days in a row to get it out the way. It's been so busy at work. I'll try to start a video, and nope, I can't turn the camera on again because it's just so busy with admissions, cross-cover pages, or just like emergencies. But, and you know, my work comes first, YouTube comes last. So, I hope you like this video. Please give this video a thumbs up. Please subscribe if you are not already subscribed. And until next time, see you later.